So we're with Charlie, and he's 7 years old. He's just come in because he's having a few random yelps and has also been on and off lane a little bit. So what we've done, we've had a run of him outside walking, and he's pretty sound today, so I can't pick up on anything. But we're just going to do a quick look over and just see if we can pinpoint any sore spots. So first of all, I start at the head, say hello to the dog, hello Charlie, and also start with the ears. So just rub each ear just in case there's a grass seed or something, an ear infection, so that will be sore. Have a quick look at your eyes. Have a look at the mouth for the gum colour, everything, but also open that jaw wide so he's not yelping there. There is a condition, they can get retrobulb or abscess where they can be quite sore when they open their mouth. Then just have a feel of his neck, so I just pull his neck right up and he's pretty happy with that. And then right down between his feet, he's happy with that. Round to one side, should be able to go right round. Good boy, Charlie. And the other side. Alright, so his head is all pretty normal, can't feel anything abnormal there. We'll just stand him up, stand, good boy. Then I give him a good massage down the legs, nothing really too bothered. I give him a good massage over his body, no sore spots, no bumps, no wounds. Have a wee just feel, rub like this with his tummy. He's nice and relaxed, his tummy muscles are relaxed, they're not tense. If they're tense or sore, I think of pancreatitis or even a foreign body, anything in the tummy or acute abdomen. He's not bloated or anything like that. He's just got a nice tummy there. And then I start with the back. Good boy. Then I start with the back and I just gently push down either side of the spine, and he's resisting. Of course, he's taught to sit, stand, so he will sit occasionally, but you really want them to not be tender and, you know, just give way as you've pushed on their back. So he's pretty happy, he's not yelping or anything with that. That's good. As far as arthritis, it can be really hard to tell, but we do check range of motion, but just generally have a feel down the legs for any wounds or obviously swellings. I just stretch that back leg out gently, and the other one, and so that's all pretty good. The vet will do a more intensive exam of legs and that sort of thing, but also just have a look at his feet. And flex each joint, extend the elbow, and then flex the carpus or the wrist, I call it. Right, you right? And then also have a wee feel over each toe. Just give it a push in case he's got a nail infection or a broken toe or something like that. And that's all pretty good. Okay. And don't forget to turn it over and have a look between the toes underneath. Oh, he's ticklish. He's actually had a wee lump removed before in this area, so it is a little bit red just from the scar tissue, but when I have a feel of that, he's not pulling back, he's quite happy. Right, so we have a look at all those feet, but that's just a general check that you could do with your own dog, and just see if you can pinpoint some areas, so then you can have a bit more of indication of what's going on. You can tell the vet when you make the appointment. So they're just great tips for checking over your own dog and seeing if they have pain. Thanks. Over here! Over here! Over here! What? What? So obviously, if your dog is into playing, it's obviously not too sick, right? What do you think? You have to leave your room, right?